recording.
Should probably not have it on the camera.
No, probably not. All right. Good morning, everyone. Calling the Board of Health meeting to order at 9:33 a.m. on Tuesday, April 11th, 2023. Our first order of business is food inspections. Yay. So, do you want to, oh, they don't have the, oh, yeah, you want to just come up front and, grab a chair? Oh, there's chairs there. Okay. So we asked Michael to come in this morning and give us an update on what's been going on. And, so Michael, feel free to fill us in.
As a reminder to the board, towards the end of last year, the health department started to switch to the FDA model of risk-based food inspections. So instead of just everybody getting 2 times a year, we identified the establishments that are deemed higher risk, variety of reasons. Higher risk population like the nursing home or the New England Center for Children, stores with a complex cooking process, raw chicken, cooling it, mixing it with other things like a Oasis Tomaso, that kind of a place. The sushi restaurants that have these special variances of mainly raw fish, or anybody that has a history of some issues. So out of around 40 food permits we have identified 14 of them as high risk. They've all already been visited twice by me last year, and then once already this year.
Okay.
The improvements of all of them have been great. From, the issues they had back in about a year ago this time to now with 4 different visits, they've been improvement just in my visits pretty dramatically. With not having to panic about, oh, we found a problem, we have to run right back and fix it. They have a couple days to fix things. It's more sanitary kind of things as opposed to a critical violation where people are more of a critical violation to that. So the elementary schools, high school, middle school are visiting this week. We deem those as a sort of a level 3. So we'll see them 3 times a year. Yes, there's a little bit of a high risk population, but their procedures are fantastic. They identify the allergies well, and they handle very little rock. So they're reheating chicken fingers. So they're not quite on the same level. And everybody else, which is about 21 establishments, are two times a year. So I'll be seeing all that by the end of the month. We have 9 residential kitchens. Now some have left, some have got a different commissary, some are up making it elsewhere in a different town now. So nothing to do with their home. I visited all five of them so far. They're fantastic.
Great.
They're all very in tune with what their needs are to have a permit and following all the proper procedures. So everybody's been very, very good. I feel like I had more, but that's that's the basic recap. So there's about 40 establishments. I visited about half of them or so. They've all been pretty good.
And these are all unannounced visits.
Always.
Yeah.
Unless
Okay.
it's a re-inspection.
Okay.
What about the home ones? Don't they have? You don't
We
give
visit
them,
them once a year. I should have.
and you do let them know you're coming.
Yes.
Yeah.
because we
You
don't
just
just want
make
to knock
sure
on
they're
their
home. Yeah.
but not all of them operate all the time.
Oh, okay. So it's
Like there's someone who only
Christmas
makes cookies
Yeah.
as on a requested basis.
Okay.
So if none of you call her that month, she doesn't do it. So she may not have the stuff. So yes, it's giving them a little heads up to have their sanitizer out and so,
Yeah.
Okay.
but at least if they still know what's supposed to be.
Right.
So when I walk in, at least they have all the right stuff. That means they do know what's going.
Okay.
But none of the residential kitchens, if you're not familiar, are allowed to cook with chicken or things like that. It's just pretty much baked goods or tea or vanilla, something.
Yeah.
But nothing requiring time and temperature control for safety foods, TCS foods, except for eggs, but that gets cooked.
Right.
But yeah, everybody, just to repeat, everybody's been receptive. The number of critical violations in every store has gone down
Good.
with each successive visit. One of the problems that we've had sporadically has been in one of the areas I didn't need to re-inspect them after last.
Okay. Well, that's good.
Which was great. And
Okay.
there were certainly a couple opportunities, but nothing glaring. And I said, you know what? Just take care of this one and I'll see you in a month. So
Okay.
there's been dramatic improvements. And
Okay.
that's the one I want to give a shout out to. I guess.
Fitzgerald's.
Yeah, that was our.
I mean, since they got rid of the food
Yeah.
and all that, there's been very few issues.
Okay.
Well, let me just take that back. I mean, there was some dirt in the bottom of a corner somewhere. I haven't found any expired products. They've changed the trash when they were supposed to. The downstairs is clean and spotless. They've been working closer with the pest removal companies. They put out more traps. I haven't seen anything when I've gone there.
Okay.
I saw some evidence 2 visits ago that we've cleaned up, moved things around a little bit, verifying that they're not putting, when they're expired product off the shelf, putting it on the floor right near where things were coming in. So they're keeping that off the shelf for now and out in the back.
Okay,
They've painted what I've asked them to paint. They patched the wall where I asked them to patch. So they've definitely made a lot of the improvements that I've asked them to over the time. And after the last visit, there was no reason for me to go back for a re-inspection. Obviously, they're deemed one of the higher risk as well,
Yeah.
so I should be seeing them in the next couple of weeks.
okay,
But
okay,
great. I think Heather spoke to them and went down from 2 visits a month from the pest company, so
okay. Of
because it had been less of an issue.
course, with the warmer weather, we'll see
That will keep an eye
what
on.
happens, right?
But again, just with any pest problem, if you eliminate or reduce the. Like something, anything to attract them in, again,
Yeah.
right, then they should start to eliminate their food sources.
Great.
So didn't have any concerns with them.
Okay,
Last time.
okay. I mean, it sounds like you're getting to everything that you
Yeah.
need to in town. So I think that's great, and we're very grateful
Very much
for all of
Yeah.
the time that you're spending here. Is there anything that we can do to better support you, or anything that you need from the board's perspective?
No, thank you very much. Heather and I work closely together every week. We touch base. I either come into the office or we talk on the phone at least weekly.
Okay,
No, everything's, the time I spent here is more than adequate to get work done. And Heather and I are working on various other projects with Taylor and certainly through Northborough and the Greater Borough Partnership.
Yeah.
To do all of the little things and trainings and expansions. I spent a week in March learning more about the FDA retail food standards, which is Heather and I something working on this week to standardize inspections, to standardize it, like the risk-based inspections, that it's part of the model.
Yeah.
Moving forward and standardizing, working a little bit with Taylor on how to investigate foodborne illnesses
okay,
and a lot of other things to make it a more robust and complex health department and health inspection processes.
that's great.
So when I'm not visiting those, we're working.
That's great. I think this, I mean, I haven't been on the board that long, but I think this is an area that was of great concern.
Right.
And that we're very fortunate to have your expertise. So, we're very appreciative
Yeah.
of
Yeah,
everything
and
that
some
you've done.
consistency with the
Yeah.
inspections, so keeps people on their toes.
Yeah.
Yeah.
Heather's online.
Can I say
Oh,
something?
Sure.
No, I think it,
Where's Oz, the wizard?
I think it's super helpful with the consistency, and we had Diane, I don't know, for about a year, but she was in everywhere. At least a
Yeah.
couple times, so then when Michael came, they're paying attention, and they have already been a bit educated, along now. It's been 2 years that someone's been coming, so they're getting on board. Michael and I are doing a summer food safety event at the library, May
Oh,
4th,
that's good.
4 p.m. Tell anyone you know to sign up to come.
When is it?
Library, May 4th,
May 4th.
4
Okay.
p.m. 4 p.m.
Okay. So that's part of Wellness Week.
Yeah, May 4th. Yeah, 4 p.m.
Put that on the
Okay.
calendar.
Awesome.
Yeah, Diane got to play the heavy a year ago. And
Yeah, Diane
I'm
came to,
I'm
right.
just picking the pieces up.
She said,
Relish.
I think we needed that.
Yeah.
Well, yeah, the stores I think needed
Yeah.
heavy hands
Yeah.
at the beginning.
Great. So we'll probably have you in the next couple months. We're gonna have a change in the board too. So, we may be reaching out to have you meet our newest member once they're, after the election.
Of course, anytime you need.
But that's great. So thank you very much.
Appreciate your time.
Feel
Thank you
free
all.
to stick
Thank
around.
you. If you don't mind, I have to love.
Go ahead.
Okay. Good to see
It's
you.
nice
all.
to see you, Michael.
Appreciate your time.
Thank you so much.
All right. Okay, so next is minutes. So I messed up and I forgot something on the 25th. So I did send you minutes this morning.
Got them.
Oh, I sent them late, sorry.
Okay, no,
Do
that's
you want to
fine.
take a second to look at, they're not that long.
Sure.
Barbara had done the 14th and I had a few track changes in there.
Yeah.
It looks good to me. You said you have a change?
Yeah, I do. So on the 25th, I have that it's a Zoom meeting. It really was in person, so I updated that.
Oh, okay.
And, I forgot the, under the first topic for Algonquin Athletic Complex. I just want to add, the board agreed with the letter that Dr. Medina put together regarding the turf field.
All
And
right.
then the motion was Ms. Malinowski made a motion to support the letter for turf written by Dr. Medina. Ms. Sacco seconded the motion. All in favor, motion passed 3-0.
Okay.
Okay.
Perfect.
All right, so I'm gonna move that we approve and release the amended minutes of March 14th, 23 and March 25th, 23.
I second the motion.
All in favor? 3-0. Thank you. Good. Okay. Okay, next is appointment of Marissa Morello as the Metro West Tobacco Inspector. So she will be at, I think, and Heather can keep me honest here, through 6/30/23, and then they're gonna have somebody else
Getting you
after that. So, so she just needs to get to the clerk's office. So we've appointed her already, but she
Yep.
didn't get sworn in
Okay.
in time, so we just need to redo it, and she's aware that she just needs to get down to the clerk within 30 days. So I'm gonna make a motion that we appoint Marissa Morello as the Metro West Tobacco Inspector through 6/30/23.
I second the motion.
All in favor?
Aye.
Aye, 3-0. Thank you. Okay, follow-up discussion vote of pool camp fees, and I'm gonna
Pull it
share.
up so that we can see it on the
Sure.
screen.
Oh, okay. So which, what do you want me to do?
You wanna start with the memo?
This one?
So last meeting, we had just talked about potentially increasing our fees for pool inspections and
Yeah.
camp inspections. And I just, well, actually Barbara, you can thank her, put together a memo. Just comparing all the other towns.
Should I find it?
There we go.
Is that the memo?
Yeah.
Okay. And I think I just need to go screen.
There you go.
Okay.
All right, so let me just share it for the Zoom people too. Um.
Yep, one to the left.
This one? Thank you. All right, Heather, you should be able to see that.
Okay.
All right.
Okay,
Sorry.
so. We are, for the pool fee, requesting to increase our pool application fee to $150. As you can see, most towns are between, $125 to $150. And then for camp fee, we are keeping the fee the same at $150. But we're asking to increase the late fee to $100 and $50 for the camp completion seasonal DPH report form. So at the end of each camp season, all the camps in town are required to send this DPH form to Barbara to send into the state. And for both the camp applications and the DPH form, we have a lot of camps that don't get them to us in time. So hopefully with these late fees, it'll be more incentive to get them on time.
So this, what we're proposing is the fee to go up next year. But the late fee to go in for the fall.
I don't have a preference. I know what's online is already on there and we've had quite a few camps send us things.
Okay.
So
So you want to wait?
I think we should wait
Okay.
until next year.
Okay.
Just so that all the information's online and
Okay.
like, there's no surprises.
Okay, and how many camps do we have?
This year there'll be more. I think they'll probably be close to 10 this year,
Wow,
Nice.
good number.
maybe a little less, but
Okay,
we had like 5 last year, and I think I know of at least 2 to 3 more that are applying this
Oh,
year.
good.
Yeah.
okay,
Last year, the new camps were Chestnut Hill, and
Oh,
then
right.
St. Mark's is restarting their camps.
Like the
Right.
flow
I don't think they're doing the Expo again,
That went
but
somewhere else.
yeah,
Oh, it did.
but they're
Probably
doing.
dating myself too. Has it been called?
No, you're not.
Years ago, my kids went to Expo. It wasn't that long ago.
Okay,
Yeah.
All right.
No, they're having a new camp, and then I think they're having a fencing camp also. so,
Nice.
yeah.
okay, and you don't even want to increase the $50 for the DPH?
No, because it's a new,
Okay.
will be a new fee, so.
Okay,
Okay, so this will go
All right.
for 2024.
Yes.
yeah. So I'm gonna make a motion. Sure. Okay, so I move that the Board of Health increase the Southborough pool application fee to $150. The camp application late fee to $100 and the DPH report form late fee to $50.
I second the motion.
All in favor? For 2024.
2024.
Okay,
Aye.
all right.
And then. If you want to pull up, the next thing is just changing our application. So if you want to pull up the old application, which is that 2021. This one, no. No,
It's the PDF.
to the right. Yeah. Sorry, didn't say.
Okay.
All right, I gotta share it too. Hold on
Yeah.
a second. Which one?
Yep.
Okay.
So if you just scroll down, this is our application currently. It's kind of just all over the place, and the right-hand columns are, there's none up here, but if you scroll up. The right-hand columns are kind of confusing about like, if you need it with you or if you don't, so. I'm just hoping to change it, and it will still have all the same information that's required by the state. And, I can show you the new one. There's a couple pieces to it.
Okay.
Go to this one, yep. So it's just a little cleaner.
Oh, yeah.
Oh,
That
like,
looks
oh.
nice.
Nice table there.
Yeah.
Like flat.
This one.
Yep.
Okay. Yeah, that's better.
And you
my
can just
gosh.
scroll down. So this is just the information that we need, but it's all in one place. And it makes it easier. And also the other thing that's added to it is, like it says right in it, like, you like have to be 25 to be like this person.
Yeah.
So it's just cleaner. The other thing is that it has more information on it as far as contact, because that's something that we really struggle with, is like finding the person's email address and like getting back to them and getting in contact with them if we need to. So changing this, and then the other form to attach is also just cleaner looking. And this is just the required document form. The required documents. So these are all of the forms that they need to supply, camps need to supply to us prior to going into camp. So they need all of these policies before they can host a camp, and then there's other things that we need when we go to inspect the camp.
So they give you, like, do they give you a copy of like their lost
They do.
camper plan?
Yeah.
Okay,
And I should have all of those before I see the camp.
yeah. Oh, okay.
But the other form, it's like you're constantly flipping back and forth
Yeah.
to try and find things.
Yeah.
And it's easy to miss stuff with all of the tables, so like, I'll have to reach out to them again and be like, I need this form. sometimes if it's a newer camp, they'll be like, I didn't see that, and I'm like, well, I understand that you didn't see it, because it's a hard form to follow.
Right.
so,
Right.
But this just makes it
Oh,
everything there, so.
Very, very.
So you would inspect every camp before camp starts?
So most of the camps they have to send me this paperwork.
Okay,
I believe it's 90 days before camp starts.
okay,
And then I go, it depends on the type of camp it is. Like, so for Chestnut Hill Farm, they have permanent staff, their structures don't change. So I can go there before
okay,
and inspect them. But for a camp like, that St. Mark's is hosting them,
yeah,
and it's like a 3-day sports camp, I would go like during the camp day.
got it. Okay, right?
Great.
Because they're just not there.
No,
before.
right,
Right.
okay. I think this is great.
This is great.
Mm,
Would be
yeah.
really
This is
well
much better.
Yeah, there's other documents to go along with it, just to be really clear, I didn't add those, but, these are the most important ones, I would say, and they meet the requirements for DPH. So I just, would like to change, starting in 2024, to these documents instead of our old one.
Yeah, okay.
Oh, yeah. I mean, sometimes you get forms and you're like, this is anxiety.
Yeah.
Like, I don't even know where to begin.
And then last one is the pool.
Yeah.
Application.
Yeah.
This is what we have right now, which we'll keep. Can scroll down, it just gives you the information that you need.
Yeah, that looks pretty concise. Yeah.
Yeah, and I don't have a problem with this, the only thing is that I do have a problem with is I think that the applicant should be able to see what we're looking for.
Oh,
Because
okay.
there's no information about that, so, I did add one.
Sorry, I should have downloaded.
Oh,
it.
that's okay. Well, I just sent it to you, so, yeah. So this would be what I'm proposing to change to, in addition to the application. This is what we're looking for, so just that places know when we're going in.
Mhm.
And we make appointments, it's not unscheduled, so they know that we're coming, what we're looking for, so there's no surprises.
And how many pools do we have? Three?
Three, semi-public. So
Okay.
one's indoor and, it's open all the time.
That's New England's.
Yeah,
Okay.
and the other two are seasonal pools.
St. Mark's in Bay.
Yes,
Is NECC inspected once a year?
they're all inspected once a year.
Okay.
Oh, you're wondering like if the indoor one that
Uh-huh.
gets used more should be
Nope,
checked more
Yeah.
frequently? No. Okay.
because we look at their logs,
Mm-hmm.
so you can see the whole year. And you can tell when a pool is doing what they're supposed to
Yeah.
be and when they're not.
Right.
so.
Yeah.
So you must have to keep logs of like the daily chlorine
Correct.
checks and.
Yeah.
Yeah.
Okay. This is great.
Yeah.
So this is just from DPH, it's a DPH form,
Got it.
but, to have it on our website and be more accessible, I think it's a
Agreed.
good idea.
Agreed. Will you do that? So you haven't inspected pools?
I inspected NECC.
Okay.
So
So when do
this-
you want to make this effective?
I already used this form, but I just
Okay.
think it would be helpful.
Got it. If it's out there.
Yeah.
Okay,
Okay.
okay. So what do you need for motions for us? Do you think we need it?
It's up to you if you want to improve the changes of using the forms.
Okay.
And, I think the camp one is definitely the one that if you needed to vote on.
Okay,
one.
yeah, I would say putting this out there, we probably.
We're not really changing.
We
the
can just put it out there.
standards, yeah. So the form it still meets the DPH requirements, it's
Yeah.
just changing the forms,
Okay,
to something that's more
Okay.
usable.
okay, so I move that the Board of Health accept the camp form changes as presented by Ms. West.
I second the motion.
All in favor?
Aye.
Thanks, Taylor. That's great.
Thank you, Kelly.
Thank you.
Okay, impact melanoma project update.
So, we have received all of the parts for our, sunscreen dispensers from Impact Melanoma. And I'm working with REC and, REC is working with DPW to get everything set up.
Awesome.
Yeah,
That's gonna be great.
That's great.
Yep.
Okay.
so hopefully, I would say by June they'll be up.
Awesome.
Yeah.
That's great. Okay, flu vaccine ordering update.
We're able to order all of our vaccine this year.
Great.
Yeah, I just reworked a couple things to make it on a little bit of the cheaper side, but it won't change anything that we've done in the past. We'll still be
Okay.
doing high dose. I still have regular flu to give to town employees,
Okay.
including school employees. Yeah, so we're
Awesome.
looking for flu season, yeah.
And Heather, did you have an update on the reimbursement side?
No, I haven't.
Oh, you do.
Yeah.
You do. Sorry.
We, yeah,
Good deal.
So. No, not, what you mean for this season? Or
For retro. Didn't I see an update on that?
we got reimbursed,
they told us the amounts.
well, they didn't tell us the whole amount. They told us the amount for Medicare patients,
Okay,
which was $10,000.
Okay.
And we're still receiving amounts for Medicare patients. And we could be receiving them through June.
Okay.
In June is when I can request to see a breakdown
okay,
of patients, so.
got it.
We probably have like, right now, like 12,000 in reimbursements is my guess total.
Well, that's better than what we,
Right, because the Medicare, they did show what 10% of the potential funds were, so we have an idea what we should get from Medicare.
okay. All right. But the good news is we're good for,
For the coming
Yeah.
season,
Yes,
right?
we're good.
okay. Metro West grant application update.
I can-
So, go ahead.
Yeah, we submitted an application that was due March 31st. And we did what was called capacity building, which is our department as a lead, to do a community, resource guide. And Northborough has done one, the Be Well, initiative has done one there. And we want to collaborate with some departments, which we already spoke with in town here. And our application is basically to support the printing, production, and mailing of this resource guide. And and just by another medium, so to speak, as our department, just to get our engagement with the community. If this is mailed to every house in Southborough, every household, just to kind of extend our reach that way. And we're working with Senior Center, Rec, and Youth and Family about getting timely resources to our residents, I think focused on mental health and substance misuse, which again, as you know, we're working on a lot with SFDR, right, with Encompass. So we hear about this in May, and if we get it, we get the funds in July.
I did work with a company, like a marketing design company, that gave us it seemed to be a very reasonable quote to put together the guide. So I'll provide them with the information, they'll put it together, make it look nice. They will print and distribute it, so they'll do everything
They'll do
for
it.
us, yeah.
Great. Good on that. Okay, Collins Center kickoff for best practices grant. So we did sign the contract with Collins Center. We're trying to schedule a kickoff meeting. I believe it's gonna be Friday, April 28th. So what I did was I reached out to the 3 stakeholders from each town.
Okay.
And then I'll leave it up to the towns whether they want to invite their respective boards or not. So I'll let you guys know what time.
That'd be great.
Okay, I think it'll be Friday morning.
And virtual, can we do virtual?
Roach, it's all gonna, yeah, everybody's gonna be on
Oh,
Zoom.
good,
Yeah,
okay.
cause I think it's too complicated. to do.
Yeah.
Like, I think it's hard enough to get a date, right?
Yeah, exactly.
So that hopefully will be wrapped up but at least the time will be wrapped up by tomorrow. is the
Okay.
hope.
Perfect.
And so I think, you know, on that, we can just post a meeting and, get that started. And then they'll probably start scheduling the interviews and stuff.
Okay.
Perfect.
Okay, so upcoming meeting schedule,
May 23rd, right?
May. Is that what we decided? Yep, May 23rd. And then do you want to pick a June date?
Did we pick one?
Did we?
I won't,
Did not.
you two pick,
Right.
because
Oh,
I
that's
won't be
right.
at
That's
it.
wrong.
Yeah.
See, it's gonna be so.
Yeah,
good.
so
Oh
so
my God.
this is
I
your
think
last
this is my
regular
last
meeting,
meeting, yeah.
meeting.
That's your last in.
Yeah.
Except for the 28th.
Right. Yes, yep, I will be.
So Safdar, what do you want to do?
For June,
Yeah,
right now, looks fairly okay. Let me.
When's the last day of school?
I think it's the 22nd.
The 22nd. So,
I would have thought earlier. Were there any snow days?
Yes.
I mean, for me, if
Really?
my
Don't you
daughter's.
remember the kids on the?
That's right, too.
I've got a senior now, so I have nothing to worry
Oh,
about.
you got, yeah, you're gonna see. So I could do,
Let me just double check something.
okay, go ahead.
June. So we could do, well, we're meeting May 23rd, right? So,
Oh, yeah, you're right.
so June 20th?
Yeah, you wanna do that?
Want to do June 20th?
Yeah.
Works for me. I won't put any-
And then what I probably will suggest is maybe for July, we do on Zoom.
Yeah, I agree.
Is that
That way
okay?
Or somewhere else, we can
Yeah,
log in.
okay.
I like it.
All right, and the extended, the
Virtual.
virtual. which is
And then
great.
we should ask our new board member, that maybe we'll just do it with her. at the next
Yeah.
meeting To go into the summer. Okay.
Yeah. Yeah. All right,
9:30?
9:30, yeah, that works. June 20th. I think I saw one kid in here. All right. She'll be here, whatever. Okay, public comment. Don't think we have any public. Nope. All right, so we're gonna go into executive session. So
Right.
I make a motion that the board will be entering into executive session for MGL Chapter 30A, Section 21 to discuss the contract for the health director as the chair has determined that an open meeting may have a detrimental effect on the town's position exemption 2.
I second the motion.
All in favor, sorry, roll call vote. Sacco,
Oh, Sacco, I.
Medina, aye.
Malinowski's aye. Thank you.